Good afternoon, everyone. On behalf of Dr. Gillian Pole and myself, I would like to welcome you all to our UCD DCU breastfeeding webinar to celebrate National Breastfeeding Week. Thank you for your interest in the webinar. Over 450 people have registered, which shows the great passion and interest in increasing our knowledge on breastfeeding and supporting women to breastfeed and meet their goals. I would like to bring to your attention today a new Level 9 Professional Certificate in Breastfeeding and Lactation that will be starting in UCD in January 2022. If you're interested in this program, please do contact Rita Pinto, our Executive Assistant, and I'll put Rita's email up in the question and answer facility for you all. I'd like to thank Justin Dawson, our Learning Technologist at DCU, School of Nursing, Psychotherapy and Community, who is busily working in the background and keeping us all online today. A big welcome to our panel speakers. We are delighted to have you share your knowledge and expertise with us today. I would like to let everybody know that the question and answer facility is open. Please do use it to ask questions, and Gillian and I will facilitate questions following each of the speakers' presentation. So I'm delighted now to ask Dr. Aoibhinn O'Sullivan to officially open today's webinar. Dr. Aoibhinn O'Sullivan is an assistant professor in the School of Mathematics and Statistics, University College Dublin. Aoibhinn is a member of the Baby Feeding Law Group Ireland and also a member of the Infant Feeding Steering Committee at the National Maternity Hospital. Aoibhinn, you're most welcome here today, and thank you for opening our webinar.
Thank you, Denise, and thank you for the invitation to take part. I really don't feel like I'm somebody who should be here. There's far more knowledgeable and experienced people to just talk about this, but as it's National Breastfeeding Week, and I think these conversations are so important, I'm really happy to join everyone, and it's lovely to see the enthusiasm on the chat. Advocating for increased supports for breastfeeding is something I've come to relatively recently, having found it very difficult to access the right supports with my second son during the pandemic. And now that I've begun reading around and researching the topic, it's something that I'm passionate about in supporting all families, firstly make informed choices on how to feed their baby, and then being able to access the right supports, be that either for breastfeeding or formula feeding for their family. But I think making that informed choice and having the right supports there is really key. I'm mindful that there's lots of new and expectant mums tuning in today as well. And I do want to say that it's such a joy to feed your baby that you can, overcome any hurdle with the right supports, but just that hopefully events like today will make it easier for you to find the right supports should you need them. And I also want to say that I'm respectful of however family chooses to feed their baby. It's important, I think, that we acknowledge the current environment that we're making those choices in. There's $1 billion and growing industry worldwide where public health is up against very clever marketing practices which prey on new mums and healthcare professionals. When you look at the advertising that's on social media, on TV and in supermarkets, they're planned on brand recognition, and the importance of the shareholder is paramount here, and it's not the importance of the health of the mother or the baby. So I think it's absolutely necessary that we in Ireland recognise that we try and protect all families from that advertising, that we support the public health system and professionals up against this industry. And I would really like to see the WHO code being implemented and that we don't see any advertising up to 36 months on food and drink products. But that's another reason why the events like this are so important for all healthcare professionals, not just the lactation consultants or the midwives, but that, any healthcare professional you come across, from your public health nurse, your GP, anybody, that they're comfortable and skilled in providing advice to families on infant feeding and particularly in breastfeeding. I think we have to make a concerted effort now in the country to boost the supports that are there. If you've heard Sabina Higgins talking about breastfeeding at any of her recent events in the past year, she speaks about almost 100% of mothers breastfeeding in Ireland at the turn of the century, but just that we've lost that. And it's so important that you have the people around you that can support you, because it is about culture and it is about having the right voice with you. I read with interest the RCPI recent report on breastfeeding, and I'm heartened to read the new HEC policy on the code. And I think that's really going to contribute to how our culture and our healthcare system approaches breastfeeding. It's something probably everybody who's tuning in doesn't need to hear it, but while breastfeeding is natural, it doesn't always come easy. Both mum and baby need time to learn and get comfortable with this new skill. And I can speak from experience to say that when it's not working, it's tremendously frustrating, and it can leave you with lots of emotions of immense guilt and grief and sadness, and also feeling inadequate that you can't feed your baby in the way that you really wanted to, the way that you chose to. That's why having time with a healthcare professional who's skilled in providing assistance and spotting the problems is so invaluable. The public health nurse I had at my first swim was literally a lifesaver, because she was coming across me engorged, in pain, frustrated, really about to give up, and she saw that my son had tongue tie. And once we got that fixed, we were plain sailing for the next 6 months. But that was 4 days of a lot of frustration. And for my second son, the midwives were amazing, who came out to my house because they realized that he also had tongue tie. We weren't going to get it fixed for 10 days, and it was excruciating. And for someone to just touch you on the arm and just go, "Oh my God, we understand the pain that you must be in. Fair play to you. Are you sure you can hold on now for the next 10 days? And it was just really important to have that. So that support from your healthcare professionals, it's so critical in the first few days, in the first few weeks. So I just want to commend everyone for joining in today, knowing about things like laid back breastfeeding, which will be spoken about today, exclusively breastfeeding in day 1 and 2, the paced bottle feeding, are all key topics that I think are going to be really, really important for mothers in the future. And breastfeeding isn't just good for mum and baby, it's also good for the families, it's also good for the planet. We have to recognize that there's a huge discrepancy in who breastfeeds in Ireland at the moment. There's a real income divide. Also, you know, not a lot of traveller women are breastfeeding at the moment, when that doesn't necessarily need to be the case. So I really admire all the healthcare professionals giving up your time to get educated and upskilled in this matter. I hope you all enjoyed the conversation today. I know there's teams of women out there supporting the momentum for change in maternity services, and so many others who are volunteering their time with all the voluntary groups out there. I think if we all work together, we'll definitely be able to see positive changes for this in the future. And thanks again, Denise, for inviting me to speak today.
Thank you, Evie. That was a fabulous opening address, and thanks for all those supportive comments and really interesting points around advertising and so forth. So thank you. Next up, we have Lorraine O'Hagan. Many of you present, I'm sure, will know Lorraine well. For those of you who don't, I'll give a brief introduction. Lorraine is the current president of the Association of Lactation Consultants in Ireland. She is a registered nurse, midwife and nurse prescriber, an IBCSC, and she holds a BSc, an MSc in midwifery and a diploma in social studies. She's worked as a midwife in many areas in different hospitals and held the post of clinical midwife specialist in lactation in the National Maternity Hospital from 2006 to 2019. She currently works as an IBCSC in private practice. She's also an occasional lecturer at UCD in the graduate diploma of public health nursing, and she delivers an IBCSC exam preparation course for the last 15 years. She's married to David. She's mum to Hugh, Killian and Aisling, and she's a new granny to Rian, Isabel and Olivia, who I know bring great joy to Lorraine. So welcome, Lorraine, and we look forward to hearing your talk now. Thank you.
Thank you, Gillian. Thank you, Denise. Thanks for inviting me to this wonderful presentation today. Fabulous to see so many people attending here today. It just shows how many breastfeeding champions we have around the country, and we are in great company here today. We've had an amazing week, so happy Breastfeeding Week to everyone, and it's great. I wish I could see everybody here, but it is great to be here today. So thank you again, Denise and Gillian, for inviting me. So my screen is up, I think, yes? Is it okay, Justin?
Yes, that's perfect, yeah.
That's great, that's great. It's kind of a busy first screen, but I couldn't resist getting lots of babies in laid back positions into the picture. A lot of the photographs today are actually mothers and babies I've worked with, and some of them are from other LCs. So if you don't mind, if nobody takes any screenshots or any of the photographs, if anybody wants handouts, I will send them out afterwards, but they won't include all our beautiful babies that are going to be here in the photographs today. So this is a lovely place to start with laid back breastfeeding, because it really is the only way I personally think that babies will fully learn how to breastfeed in a very gentle, lovely way. And I am cognizant of the fact there's people here that are very, very experienced, do this all the time in their work, and others this might be new to this. I was teaching the students in UCD this morning, and this was new to them for the first time. So ideally, it would be great to know how experienced everybody is, but that wouldn't be possible with 500 here attending, or 450. But briefly, we're going to look at, and hopefully you will understand the benefits of skin-to-skin contact and how it enables babies to self-attach. That you will understand, these are the learning outcomes for today, that you will understand what is laid back breastfeeding. And it's also called biological nurturing, and it's also called natural breastfeeding. And natural breastfeeding is my favorite term because it is nature at its very best. So I will use these three terms as I'm going through the presentation here this morning or this afternoon. The learning objectives, you will understand the benefits of laid back feeding and how it encourages self-attachment, that you will gain some insight into the past research, kind of seminal work in this area, and current research that's just out and the whole area of laid back breastfeeding this year, and learn how to facilitate laid back breastfeeding with mothers and babies. I love this slide. I will have to spend a few minutes and I will watch my time. Denise, I will try and do my best to get this all wrapped up in half an hour. This is, oops, let me just get back there. I suppose for me, this is where it all begins. Obviously, the labour is very important, and how the baby comes into the world is very important and will have huge effects on breastfeeding. But the 9 instinctive stages of skin to skin, many people here will know about it, but I do want to spend a little bit of time on it, also called the magical hour. And there was some fabulous work done by Kaiser Brinder and Anne-Marie Windstorm and Karen Caldwell some years ago, going back to 2010, 2011. And they videotaped hundreds and hundreds of babies in the first hour or two after delivery and found this beautiful 9 that babies go through. You know, it's not kind of, you know, they might breastfeed, they mightn't breastfeed, that is all disorganized. It's highly organized in the baby. If the baby is left with his mother on the mother's chest wall, just the mother and baby, the baby will go through these 9 instinctive stages to latch and attach and feed. And this kind of came out before Suzanne Collison's work, which I'll talk about in a moment. So the first thing, the baby cries, and everybody's very happy, and a beautiful baby has arrived. And then the mother and baby will have a relaxation phase. So it's very important that lights are dimmed and things are comfortable and easy for the baby. Of course, babies are born at home or in their own environment, and all of this is so much easier. Different, you know, mothers are not in their homes, they're in hospital environments, but the baby will then go into a relaxation stage with the mother. They're so connected, mother and baby, they're just one in these early months after delivery. And then there'll be the awakening stage. And you can see in this slide, I love it, because the baby wakes up and it's holding on to its mother's hand, or the mother is holding on to the baby in a beautiful palm or grasp going on there. An awake baby, beautiful connection with its mother. And the next stage then is the activity stage. And the activity stage, I think, is just mind-blowing, that this little baby starts making sucking sounds and then will move its hand, a brand new little baby, it'll move its hand over to its mother's breast and then will put its hand into its mouth. It's not that it may do this, it might do this. They actually go through this if babies are allowed, be with their mother, and skin to skin is totally fostered in the early days, weeks and months. This will really help the baby get a gentle start to breastfeeding and learn to breastfeed without difficulties, I mean, in general. So the baby has this activity stage, and I love the way the baby can touch the mother's breast and put its hand into its mouth. And they may do this several times and then have a little rest, depending on their delivery. And there's no time scale on this. This can take a little bit of time, or a little bit more time, and then back again to the mother's breast. And how clever is that? So we must, babies' hands are so important, that they're not held back, that they're not restricted. They need them to make that connection with their mum. and that they're going to feed. And the next stage is the crawling phase. And doesn't that just blow us all over? How babies actually can crawl to the breast. This brand new little babies come into the world. They're not helpless by any manner of means. They're primed and hardwired to get to their mother. And if you look at every other mammal, it's the baby mammal, that gets to its mother for feeding, not the mother to the baby mammal. So babies are actually no different. And then they do the crawl. And I just love witnessing that all the time. It's just so amazing. It's, of course, it's really facilitated. The mother is not lying flat. This mother's a little bit flat in this picture. If the mother is semi-reclined, the baby has somewhere with its feet to start moving up the breast. And if it's up too high, it'll just move its shoulders down. And then it does this magic of moving over to the breast. And I love watching, and I've seen it so many times over the years. The baby, often you don't know which side they're going to go. They kind of, will I go here? Will I go there? And they just often, sometimes can rock it over, and sometimes they go in kind of two phases. So the very new baby tends to kind of move over a little bit to the breast, and then the second move. Babies that are sometimes a little bit more robust and a bit older can rock it over. So I say to the moms just to be very careful that that maybe their hands are kind of nested in some ways to catch the rocketer, because they can rock it off the bed very quickly if we don't keep it, just have a little safe area for them to go to. But the very brand new baby tends to go over in two movements. And it's not that some babies might do it this way and other babies might. The more babies you watch doing this, they do it in a very synchronized way, an organized way. And then I just love the next part. So they put their hands, if their hands are free, either side, usually below the breast, and they do, any yogis out there, they do a cobra. So they kind of push up with their head, lift this part of their body up. How amazing is that? Now, obviously babies that have very sore heads, forceps deliveries, these babies may find it a little bit challenging in the early days, but babies have the ability to use those hands again, not have them tied up or not have them tucked in, rather than tied up, and move their head up and come up and over onto the breast. And of course, the breast is aimed in the perfect way, isn't it? It's there for breastfeeding. It's the lovely tilt of the breast happening by nature, because the mother is tilted back. So we don't have to be thinking about nose ups at nipple and all of that. And the baby gets on in a really, really good latch. Now, in the early days starting off, they often take a while to familiarize themselves to the breast, and the hand is out here again, the tongue darting. Often they just lick the nipple and eventually it will go on and suck. And you can see this baby, the intense look on its face. It's realized, oh, this is my milk, this is my mummy. And then they fall asleep together generally. I think this is mind-blowing. I think this needs to be all over every delivery suite, and each of and every one here to share it. I just love it. So what is biological nurturing? And looking at my time, it is biological nurturing, laid-back breastfeeding, or natural breastfeeding is formally defined as a collective range of terms for mother-baby positions whose interactions appear to release both mother and baby's innate behaviours. Isn't that what we want in the early days? We want to make it really easy for the baby to learn to breastfeed and for the mother to learn to breastfeed. And in laid-back breastfeeding, these innate behaviours are released. And that comes as a quote from Colson et al. In 2008. And we do have to thank Suzanne Colson for all her recent work, because she said mothers probably always fed in laid back until health professions came along and, it's all, let's all sit up here together. Before it was something that mothers learned breastfeeding in the past from other mothers and from their family. It wasn't always from health professionals. This is recent history. So in BN, I'll call biological nurturing, mothers neither sit bolt upright or lie on their side. Instead, they're semi-reclined and the baby is placed on top of their bodies. So the entire frontal aspect of the baby's body is facing, touching, and closely applied to their body curves, or part of the environment. So a lot of people say to me, oh, Lorraine, that the mothers that have sections, they can't really do that because, the baby's legs will be on their womb. It's the environment as well, as long as the baby is supported, and I'll show some photographs of that later. Biological nurturing is it's a mother-centered approach. It empowers with the mother for breastfeeding. It consists of a range of mother and baby behaviours and positions, and maternal comfort is a priority. And it does increase more enjoyment and reduce fatigue. And it's underpinned by both nature and nurture, but with nature at the forefront. So the research that was done by Suzanne Colson going back in 2008 and published kind of at later age, and her book came out in 2010. I love this little book. All of these are referenced in my if needed. She analysed the effect of gravity, again in videotaping 93 feeding sessions of British and French mothers during the first month of the baby's life. And she is a British midwife, and she got her PhD work from this, and it's a wonderful piece of work. And she identified 20 inborn reflexes used to get the baby to the breast for feeding. And as we all knew, there was about 3 reflexes, very, for feeding. But she went through all the literature and found that actually there's been more than 50 neonatal reflexes described in the literature, and 20 in particular help the baby for feeding. And this is new and revolutionary at the time that she was talking about, because we really didn't realize there were so many to help baby feeding. So I took all of her ones from her books and from her publications and just put them into a little colored coded area here for us quickly to have a look at. So hand to mouth, we know about mouth gape, tongue dark and lick. We saw it in that little baby in the slide. But a really important one is arm and leg cycling. So a neonatal reflex to help the baby breastfeed, and that is a release during feeding and to help the baby, is that it cycles its arms and cycles its legs to breastfeed. And I'm not trying to, all other positions can help with feeding, of course, and mothers can adapt to any other positions, but we really are not helping babies release this breastfeeding in other positions, this actually neonatal reflex, because one arm is maybe tucked under the mother's breast, and the other arm, as we know, is doing lots and lots of cycling and really trying to get in the way of feeding. But it's actually really useful when the baby is laid back, because it's cycling its way with its hands to get to its breast, and makes the baby very contained and very focused. It makes so much sense, doesn't it, that it's feeding and its hands are usually hugging the breast in laid back feeding. When it makes its way over, these hands have done all the work to get there, and they're either side of the breast. And I think that makes the baby very contained, content, easy to sustain the feeding, easy to stay feeding. We also have the finger flexion extension. We know that one, and there are cues for feeding. Then she described the motor finding reflexes as the stepping and crawling. Yes, we know babies can step and crawl to the breast now. The palmar grasp, as we saw, something called placing, hand-foot reflex, and Babinski. We don't have time to go into all those in detail now, but they are important for feeding. Suck, swallow, and jaw jerk, we would have always known they were the rhythmic part of the feeding. But her PhD findings, where she got an award for all of this work, was towards the anti-gravity findings. She called them head writing, head lifting, rooting, and head bopping. They worked very well in laid back. They worked against feeding in other positions. So you all remember the woody woodpeckers. You would often see these babies that are trying to get on the breast, and their little heads, they're going in and out, and they're starting to get very frustrated. That happens in upright. When it happens in laid back, that head bopping helps the baby latch. So these reflexes are all triggered best when the baby feels pressure on their chin, their torso, hips, and feet. So if the baby is lying on top of the mother, there is pressure in all those areas. It can be triggered in upright positions, but gravity makes breastfeeding more challenging. So in her study, Suzanne Colson's study, when the mothers tried to breastfeed sitting up or lying on their sides, gravity pulled their babies away from them, creating gaps between them. And many babies became frustrated and upset. We have seen that often in the past. I mean, this is my go-to in everything I do now with mothers, and maybe for 10 or maybe nearly 15 years that we know about this. But when mothers use what Colson calls laid-back breastfeeding, the dynamics are very different. Gravity keeps their baby's body securely against them, so there's no gaps. And it creates triggers for more continuous feeding and less interruptions. She concluded in her research, and other researchers and big buffs around the world in breastfeeding do acknowledge this as well, that babies, you don't want to compare them to hamsters or puppies, but they do feed better like hamsters and puppies when they're feed on their tummies. And especially during the early weeks, using laid back positions reduce the steps the mother needs to remember. There's about 3 steps, and I'm going to get through to them now. So, a mother very tired, part of her brain to use for breastfeeding. There's a lot to remember in other steps for breastfeeding. However, in laid back, there's only 3 steps, and that really is very empowering for the mother, and we'll just go through those. And also what happens is the mother has hands free. And I love watching mothers that do biological nurturing and laid back feeding, and their hands are free and they're often just stroking the baby's legs and stroking the baby's feet, and it's so beautiful to watch. And you know, people say to me, well, Lorraine, if people start this crack now, how are they ever going to breastfeed anywhere else and go out to Starbucks and breastfeeding? They actually adapt to all other positions so easily because they've got the opportunity to learn in a very gentle way in how to breastfeed. Nobody's holding them, nobody is any restrictions, and I'll prove that point in a minute with one of my own little babies that I'll show you pictures of. And I have said this already. I've referred to this one already. So how to do biological nurturing, I'm very aware of our time, is first encourage all mothers to hold their babies for as long as and often as they want in skin-to-skin contact without any fear of spoiling the babies. I think obviously this audience absolutely knows this. And then just to suggest that the mother leans back and relaxes, supporting every aspect of her body, getting as comfortable as possible. Now, mothers can start laid-back feeding sitting up, but a lot of mothers, I would always recommend, you know, they can do lots of skin to skin as a pre-request to actually the baby feeding, as we discussed. But laid back is when the mother is supported on her pillows or wherever she's going to breastfeed. I'll show you some nice real pictures in a minute. This is lovely. Leslie were always ahead of things, brought out this picture of mother laid back feeding many, many years ago, and I have permission to use it. It's an image from their Leslie leaflet. And this is exactly for the babies. Look, these babies can stretch out, and all of the things we talked about, the baby's tummy completely connected to, I see Mary Bird raised her hand. We'll get to you, Mary. Mother very comfortable. I really feel mothers carry so much tension. We all do on our shoulders, and really laid back is very kind to the mother too. This is one of my own babies from the National Maternity. I just have to tell you about this baby, and I don't know how our time is going. This mom arrived into the National Maternity many years ago. Denise and I and Catherine ran the breastfeeding clinics, and Gillian joined us at some times as well. And it was a very busy clinic. So, you know, you're kind of getting through mothers very quickly, nothing like private practice now when you're with mothers for hours. And this mom said, I've pumped for a month, my baby's a month old, I've pumped for a month, and my baby's never breastfed. And I fed, and I don't know why, I never, you know, so busy, I never asked her, why didn't you come to us before now? But I said to her, look, I'm going to show you something called laid back breastfeeding. Would you come down to one of the physio rooms? As you remember, Denise, we were always borrowing all those rooms. And I said, this works if you offer the baby both breasts. You just lie up on the couch, and I pulled up the physio's couch, just put her up half sitting, half lying. And laid back works very well with some clothing on as well. As skin to skin, obviously need more, baby, very little clothes on. But Suzanne Colson said it always works with babies semi-clothed like this. And I went, this really is the truth. Honestly, it's such a good story. But because he was a big, robust baby. And I said, if you put your baby just between your breasts, and I was just getting to the part for maybe, you can maybe nest your hands around, because babies sometimes can rocket over. And this baby just rocketed over. Thankfully, we had a wall. And looking if she had her hand out, and he just tilted back his head and he just latched on. And the mother, I can still remember her face. I wish I had videoed it, but I did say, is there any possibility I could take a photograph? This is so precious. And she absolutely, Lorraine, and share it in your presentations, but I don't send it out. This is the biggest audience that's seen this little baby, but not identifying the mom. But I just love this. I remember it so well. And then, of course, the physios wanted the room back. So after about 10 minutes, we went back, going back to a busy clinic. And I said to Mum, we'll try the other side now. The baby had a beautiful feed. First time the baby ever breastfed. I'm not saying it always happens like this. He was a month old, so I think he was more robust. But the triggers were very fast, and they must have all been ignited with him in the laid back. And the mum came back, and we sit up in the, because it's all sitting up positions in the clinic, in our clinic room, although some mums lie in mattresses on the ground as well. And no problem for the baby to go to the other side. That was such a happy mum leaving our clinic that day. So because babies start like this, babies will go on to feed in other positions. It's just a way of, and it can be done at any stage. Here are two from Nancy Moorbacker, two beautiful pictures. of babies in laid back feeding. Look how comfortable the mothers are, and look how snug and comfy the babies are in feeding. You can go on to the public domain and look at Nancy Moorbacker's work, and it's referenced here later on as well. And she's beautiful pictures for any newbies here that want to learn. 3 steps. Mother lies semi-reclined and supported. She lies her baby on top of her body, and then nesting her hands, I do think, can be important depending on where she is. And then when the baby moves over, some mothers, not all, might have to adjust their breast a little bit or adjust the baby. What I love about it is you don't give really any more, if mother asks for instruction than that, because the mother gets really confident. You see the mothers and their babies are with them. I have not a real baby, of course, here today. I've only got my little dolly. But the mothers, often the babies might go this way or even this way. But when the babies tend to rock it over, or go over, that's my new word today, the babies go, they tend to go like this. But you see the mothers kind of moving themselves around and trying to get as comfortable as possible. It really is lovely to see mothers becoming mothers in front of your eyes and growing in confidence. I suppose the other great
10
thing.
10 minutes then, Lorraine, just so you know.
Brilliant. Oh, goodness.
But we have a few questions as well.
Oh, super. I'm nearly finished. And one thing I would say about the laid back is the mother doesn't have to apply constant pressure to her baby's head, neck and back in laid back, because the baby's been supported on her chest wall. And I think that's great for the baby. I think we annoy babies so much. If we're holding back their arms, if we're kind of, holding them, their back and the neck, putting them on, works very well in many, many scenarios. But I think laid back is a great place for mother and babies to start. This is a little video. I don't think I'll have time to play. It just shows a baby with good feeding. But this one here is, look how comfortable this baby is. Beautiful phalange lips. And they get that latch always really, really, really well. The neonatal lie was something Suzanne referred to, longitudinal, transverse and oblique. It's almost like the baby's back in the womb again. But she says the baby, there are 270 positions the baby can feed in. She said the breast is like a clock, and she, in lots of her presentations, says baby's feeding up like this. Which I've actually never managed to or seen it in my practice, but I think the majority of babies just feed very comfortably in the oblique lie. I find our longitudinal, great for twins. Like fabulous mother with twins there last year. Poor mother had MS as well. She had twins, and she used to feed them one on each side longitudinally, or sometimes they would kind of kneel on the bed. Yeah. There's also this beautiful oxytocin pulsatility that goes on, so it's the mothers feel much more relaxed with laid back feeding. It happens when mothers feed, but there is a lovely lots of relaxation. Quick one, and I'm finished, Gillian. The latest research on laid back breastfeeding, just published, hot off the press, 2001. It didn't look at all the things I've been talking about, but it looked at the effectiveness of laid back positions on lactation-related nipple problems and comfort. Very important that mothers do not get sore nipples. It was meta-analysis by Wang Liu and May. 12 studies, not massive meta-analysis, but not too bad. 12 studies of 1,936 patients. Findings showed, compared with traditional breastfeeding positions, that laid back breastfeeding has been proven to be related to a decreased incidence of nipple pain and nipple trauma, and was statistically significant. There are the references, couple of takeaways. It's a non-prescriptive way and easy to do. There's little for the mother to learn. And read the rest of them. It encourages and allows mothers and babies to do what intuitively they know how to do. And I will send all those on to you. Sorry. Yeah. So, Gillian,
Lorraine.
That was so lovely. I would love to be here for an hour or two, but I do respect, hopefully I didn't go over my time.
That was absolutely perfect. Thank you, Lorraine. Absolutely fabulous. And it's a pity we're not all in a room, but we do feel your enthusiasm, and as ever, you're such an engaging speaker. So thanks for that. So we have a few questions and lots of compliments in the chat as well, Lorraine. You'll be able to see them yourself. So the first one is, I just might read it out to you if that's okay, Lorraine.
Oh, please, Gillian.
Respond. If skin to skin isn't immediate, do the 9 instinctive steps not happen at all, or can it begin as soon as skin to skin is initiated after interruption?
Great question. Many babies don't ever get, don't get that chance to get to the mother. They might have to go to the NICU or for different reasons. It will happen. It might happen like in the first hour, the baby's really only learning. It might take a lot longer. But it can be initiated for many months after the mother's had the baby. Yes.
Wow. Okay. Thanks, Lorraine. That answered that perfectly. The next question is someone who has been working with mothers and babies a long time. However, they find sometimes mothers may have a reluctance to try laid back breastfeeding because they feel they're not in control. And they're right, of course, because the baby that feeds from the mother is more in control, and because they haven't been shown this in hospital. What 3 ways do you think hospital staff and community breastfeeding supporters can encourage mothers to feel more comfortable and natural with this position? I think you might have covered some of them, but just maybe 3 tips.
Well, very briefly, I fully get that, because actually laid back might be for every mother, so quite exposed, and some mothers might feel, as you said, the whole control issue. So you can start laid back actually sitting up and then go into the laid back positions. So, there's lots of ways that we can help mothers do it. Hospital setting, I think selling the 9 instinctive stages, getting the posters, you can buy lots of posters and I can give you the links for them, buying all those posters that show it, because everybody here is probably very convinced, but others might think that, a little bit, that mightn't happen. So I think starting off with really transferring babies skin to skin if they haven't actually fed. I sometimes think, does that really annoy the baby? And now the baby has to kind of start all over again. So I think if the baby might be only have done a few little things, hand into mouth, and now we're wrapping the baby up and the baby's, transferred. I think the baby should be transferred skin to skin in the mother. And I really think that, that would make things easier. The second thing maybe I just do one more in the hospital setting, because I kind of mentioned a good few, is maybe some ward would decide, we will audit this in our practice. This is the way for the next month or 2, we're going to see, will this cut down on babies not being able to attach, mothers with sore nipples? It's really worth doing lots of, trial and error on wards and seeing, is this helping mothers learn? And it's very hard for mothers to take everything in, because I do think mothers need to learn other positions as well within the hospital setting, but a great way to start and to learn it antenatally, maybe to show that screen I showed you to mothers antenatally, Gillian, I think.
That's great, Lorraine. It's actually touched on another question from the same person around auditing. So I think what you say, maybe it would be a good exercise to audit, different positions and how the breastfeeding goes for the dyad. So that was related to that. And one final just question, quick one. If the baby's still fussing and getting very agitated and upset when placed on the mum's chest, what do you recommend?
Yeah, that is a really good question, because the one thing I would say, do absolutely nothing, as in just go back to the mother keeping the baby skin to skin, because the skin to skin will release lots of oxytocin from the mother and will help the mother relax. Because we are talking about a mother might be up all night and maybe a little bit nervous with babies. So I think I always go back, if there's any problems, just let the mother and baby be together. Because baby will never breastfeed if it's very agitated and very crying. So I think settling the baby and kind of going back to helping the mother learn that when the baby is with her, skin to skin, that this will really help her relax and help her feeding. Because sometimes with the mum, isn't it? The mum can also have had a traumatic time and a difficult time, and the skin to skin just floods her with oxytocin.
Fabulous, Lorraine. Your experience, thank you so much for sharing your experience. I'm sure we've all benefited from that now today. And thanks for a fabulous presentation.